You're listening to the Jōrni Podcast. What happens when psychiatry moves beyond symptoms and diagnoses and starts treating us as whole humans? Stay tuned for a conversation that reimagines mental health care. This episode contains adult subject matter, and some listeners may be triggered by this content. Listener discretion is advised. Hi, I'm Petra Brunbauer, and with decades of experience with sadness, pain, anxiety, and stress, I finally figured out how to leave all that behind. And this podcast shows you how to break free permanently so you can reclaim your sanity and find the self-esteem and energy to go after the life you desire. With real talk about mental health, holistic healing, and the tough journey of coming out the other end. This is the Jōrni Podcast. Welcome to today's episode. In this episode, we explore a fresh approach to mental health care that integrates both traditional and innovative healing methods. Our guest brings deep expertise in psychiatry and holistic practices, opening a window into the emerging field of psychedelic therapy and its role in transformational healing. Dr. Zand is a practicing psychiatrist and a recognized leader in holistic mental health and psychedelic therapy. He has trained over 100 clinicians, teaching at multiple residencies and medical schools. As an expert in addiction medicine, Dr. Zand has served as the medical director for several recovery and residential treatment centers. He also operates Metamorphosis Resort, an immersive jungle retreat center in Puerto Rico dedicated to transformational healing experiences. As the founder of Anywhere Clinic, Calm Clinic, and Better You, Dr. Zand leverages his Johns Hopkins training in public health, entrepreneurship, and management to deliver compassionate, insurance-covered mental health services across more than 20 states. Driven by a mission to evolve the standard of mental health care, he is committed to ensuring that everyone has a supportive partner in their life journey. Let's meet Dr. Zand. Hi, Dr. Sam. It's so great to have you on the podcast today. I've been looking forward to getting to chat with you because holistic psychiatry is such a fascinating topic, and I think something we definitely don't talk about enough in this world. And I think also might have a little bit of a bad reputation when it comes to psychiatry. Might scare some people when we talk about that. So I'm curious to find out your expertise and your experiences on that. Welcome to the podcast.
Yeah, thank you for having me. It's a pleasure to be on. I think it is an interesting topic because psychiatry isn't really what you think of when the terms holistic come up in mental health. Psychiatry seems very pointed in the medication direction. And I think that's true for many, many decades. Our industry has started really with psychotropics, but recently I think we're evolving. In the last 5 years, we've learned a lot more about the brain than we ever have. And psychiatry now is becoming, I think, one of the cutting edge fields in all of medicine because of all this new understanding. So I'm really excited about what holistic psychiatry really is bringing to the community and how this will continue to evolve in a very positive direction.
Yeah, absolutely. I'm curious about all of that. So for starters, would you like to share a little bit about yourself and maybe the parts of your story or your journey that relate to what you're doing today? And maybe let our listeners know a bit about what it is that you do today so they can get to know you.
Yeah, absolutely. I grew up with a lot of love in my life. I think that's a big part of my journey is that I didn't really have a lot of traumas and tragedies and uniquely was kind of sheltered and my family was very loving. I had little quirks in the family like we all do, dynamics and the angry father figure, but also very loving. So for me, it was always trying to cater to making sure everyone else was feeling okay because my cup was generally full in my youth. When I got into my academics, I always had a little bit of an interest in the mind. My dad's an engineer, my mom's a psychologist. So engineering the mind really became obvious as where the path I wanted to go into. My early exposure to psychiatry was really disheartening, I think. We started to see the industry as what it is. It was at the time when I started my academic career 20 years ago, a lot about just diagnostics and algorithmic approach to care. And if somebody's dealing with this symptom, they must have this illness. And if they have this illness, then we should give them this medication. And none of that made sense to me. I started my academics at Johns Hopkins studying public health. I think my worst class that I ever scored in, my only C in all of undergrad was Introduction to Psychiatry. I hated it. It was from that point where I realized my interest in the mind has to challenge the status quo a little bit rather than go with it. So in medical school, I was a little bit of a rebel. I was always questioning things. Went to UNLV in Las Vegas for residency. And in Las Vegas, we say there's a lot of pathology. If you can heal Vegas, you can heal the world. And so there was no shortage of just learning about different interesting manifestations of the human mind. I almost got kicked out of residency several times just for challenging things and questioning the way we're practicing. So finally, I had the exposure to the outpatient world where with more autonomy and more guidance, I learned more about Eastern medicine, more about therapeutic strategies that weren't really introduced as much. We talk a lot about CBT, cognitive behavioral therapy in our work, but I started learning more about somatic work and more about the really depths of psychoanalysis and psychodynamics. And then psychedelic therapy came on my radar. And that was something that really shifted the entire way we looked at our health, our not only mental health, but our whole being and our perspective and understanding of life. With those introductions, that was much more self-taught and just from experience with people in the communities, but then went on to greater practice, started in Vegas. We're now in over 30 states in the US. And it's been really refreshing to train clinicians who want to learn more holistic modalities, to work with patients on the biopsychosocial spiritual model, and to see where psychiatry is taking us forward into the future. I've become less of a rebel now and more so just diving into the current of where we are and helping it move forward.
Yeah, thank you for sharing that. And I love that journey. I also love that you were a bit of a rebel because honestly, that's how things change. That's how we bring change to the world. Somebody usually finds something to optimize or improve in one field or another. And that's how we move forward. We make new discoveries. And sometimes that takes a little bit of the old giving way to the new, or in this case, some more ancient therapies. But yeah, absolutely. That's fantastic. Now, how was the uptake on your perspective that psychiatry should be maybe a bit more holistic, a bit more integrative? Is this becoming mainstream now, or are you still finding that there's a lot of resistance towards this kind of treatment model?
I think it is. I mean, not to say that this wasn't how we were trying to practice for years. The biopsychosocial spiritual model, looking at the lens of mental health through how we're doing physically, how we're doing psychologically, how we're doing environmentally, and how we interact with the unknown in life, the spirit, the parts that science can't explain. I think that model's been around for decades, but in practice, mostly used by therapists, not by psychiatrists. And I think that's really the shift is meeting people where they are and not leading with diagnostics, not leading with this sick care model that, okay, there's something wrong with you and we need to fix it. Instead, it's a self-exploration model. And as a psychiatric provider, we're there just to shine a flashlight to help people learn more about themselves. And then we're equipped to help intervene physically with medication if necessary or other techniques, procedures that are becoming popular that are not medication. They're not just take a pill every day and forget about your problem. I think we're seeing much more advancements in treatment modalities. So now, is the whole community adopting this? I hope that more and more we're seeing these treatments lead the way for more education and understanding, but we're still very much stuck in a diagnostic model, in a sick care model. And I think that that's one of the novel approaches that we're bringing to the table is we don't talk about diagnostics. We don't tell somebody we've diagnosed you with bipolar disorder, and this is what that means. But more so, we explain what the presentation is and how this is not static. This is dynamic. This can change over the course of our life. And it's not who you are. There's no blood test or image that proves these diagnoses. But more so, let's just understand what's contributing to who we are. And instead of focusing on what's only going wrong, let's focus on what's going right. Let's maximize that. Let's lean into the unique qualities that we might otherwise have pathologized. This is where the term neurodiversion and seeing people as not a one-size-fits-all model can solve that, right? Everybody's uniquely beautiful, and all of our traumas can uniquely turn into triumphs. How do we now bring that more to the medical model? That's a challenge I don't see us overcoming because of decades of infrastructure with insurance and pharmaceuticals and just the medical model in general. It's very hard to disrupt that. But I think the way that practitioners and us going in to see somebody, if we can reframe the conversation, there's nothing wrong with us. We're just trying to maximize our understanding and maximize any positive change and any current patterns that we really want to continue nourishing.
That's a really fascinating perspective. And I'm glad that you are joining me today to actually talk about this and put this out in the open. A lot of people like myself who's been stuck in the mental health system for quite some time in my teens, in my early 20s. There's always this sort of vision of these asylums from the 1950s where people just get put because there's something wrong with them. Not really, but that is what society thought. And you medicate them and stick them in there and kind of throw away the key. And that's always been a really scary thought. And it is for many people why they don't want to seek help or why they don't want to seek support, because of the fact that then they have to admit that something is wrong with them. I like the way that you're starting to look at this in a different kind of way, that there are many different ways of being human and there's many different ways that we can be in this world. For different kind of mental health challenges, if we're talking about bipolar, we're talking about schizophrenia, are there ways that we can work with that in a more holistic model that you're proposing, or does there always have to be a medication component, or how do you approach these bit more challenging situation once it comes to mental health?
Yeah, that's a great question, because if we start with the most acute, that's why psychiatry as an industry even began, right? It was those schizophrenic patients that were psychotic. It was those patients who had such extreme, we call it hysteria, panic attacks that were uncontrollable. But we didn't know what else to do back then. We're talking about 100 years ago. Psychiatry is a very young industry. If you look at cardiology, it's many hundreds of years. So 100 years ago, we said, okay, let's put these people in asylums. And they're not functioning well in society. Let's do our best to put them somewhere else and give them another level of care and a different type of life. Unfortunately, that turned into just tying people down and the horror stories of asylums of 100 years ago. It was the 50s when then we discovered antipsychotics, an actual medication agent to help with schizophrenia. And that was the birth of the psychopharmacology industry, because before we were using medications for maybe 20, 30 years in a very controlled, systemized way, but for physical illnesses. Now it was the first time we said, oh, maybe a mental illness can be treated. Again, I don't even like the term mental illness. I think we should be focusing on mental wellness. But in the 50s, then it was a good solution compared to what we had previously. This was the time of also lobotomies, right? Actually chiseling into the brain from the orbital socket. It's insane that the psychiatrist who invented that, he actually won a Nobel Prize for it, but he ended up killing 1 out of 3 or 1 out of 4 people under treatment. So that's where we came from. Now, can we treat the sick without medication? Can we treat people who I would classify as having neurological conditions? When you think about schizophrenia or extreme bipolar mania, I think in the future, maybe 10 years from now or more, we'll start to see these reclassified as neurological conditions that we fully understand. Maybe not 100%, but much more so than we do now. Right now, we're living in the world of hypotheses. We don't even know really what causes schizophrenia or why we have bipolar. We have hypotheses, but none of it's fact, none of it's known. Science is exploration, not explanation. So we get to a point where, can we treat schizophrenics with some of these newer tools and deviate away from dopaminergic agents is what we used to use, right? Shut down dopamine is what we thought is responsible for psychosis and mania. And although we know that that's part of it, there's much more. There's different hypotheses now. For schizophrenic patients, I think what we overlook greatly is the relationship they have with their perceived illness. And this is something that we can talk about: depression, anxiety, any of the well-worried, all the way up to the extreme psychotic. Because we're just classifying it as a mental illness and saying the solution is a pill, I think we're overlooking therapy. We're overlooking all of the health factors that contribute to schizophrenia, the brain inflammation, the generational trauma, the idea that this runs in the family, and the parent, knowing many times that schizophrenia runs in the family, it's almost like they manifest it in their children, because it's this fear, this heavy fear that's leading the way. It's getting in the way of the love that also should be leading the way, or so takes the lead away from the fear. So I think love-based care in schizophrenia has been lacking, almost zero. Now we start to realize that if we can start incorporating more, not just what we've been doing, which is life skills, make sure you brush your teeth at night and things like that, but more psychological awareness for those sick populations when they're feeling better. And I think that's where medication and holistic strategies go hand in hand. Because if somebody's psychotic or in a full blown manic episode, these holistic factors don't help as much. So let me get them as stable as we can. The other thing that's very interesting is we were largely only using dopamine agents for schizophrenia. And now we have agents that are more glutamanergic. We have agents that are actually used for dementia that we're seeing as helpful for schizophrenia. So the toolkit is expanding, as well as now let's talk about nutrition and how that affects not only our physical health, but our mental health. Let's talk about our relationship with the unknown. This disease is in that category. Right? We've been told our whole life we have this disease, schizophrenia, but there's zero scientists in the world that fully understand it. So let's put that in the category of the unknown. And there's a huge overlap between psychosis, extreme mania, and religious persecutions and spiritual thoughts. Well, let's bridge that gap and let's not make it a symptom anymore, but rather a treatment. Let's explore spirituality in a way rather than demonize it as just a symptom of what you're going through. These are the things that I see in the most extreme cases still have application. I've even used low dose psychedelic therapy for schizophrenics. It's a very experimental and controversial treatment. Most people will say you should not do that because it can exacerbate psychosis. But I think there are cases where all of this can be possible, and we have to look at it on a one-to-one level and really lead with care, compassion, and love, and not algorithms, textbooks, and ancient medical models.
Yeah, that's a really good point that you're making. And I think this is the standard of care that will bring these new ideas together, that will bring these new standards of care into mainstream is I almost want to say a bit of experimentation, but it is exactly that, unique to each person to find out what works for them. If we're talking about a more holistic model of psychiatry, what are we generally talking about? I'm kind of imagining that this has to be multidisciplinary. There have to be maybe even different care providers or therapists or practitioners involved in a care like this. So, what kind of things come together when, for example, you're working with individuals who may have anxiety or depression or any number of challenges that are challenging their mental well-being? Where do you start with sort of the holistic model, and who or what, in your opinion, should be involved in that?
Yeah, great question. I think when we talk about a phrase that's become popular, integrative psychiatry, we're talking about a systems-based model where we want to integrate nutritional counseling. We want to integrate endocrine understanding of the hormonal system. We want to integrate all of those things. When we talk about holistic psychiatry, we're leaving the systems-based model. We're saying these things are not separate. You don't want to go see an endocrinologist only for your hormones and be blind to everything else. You don't want to see a cardiologist only for your heart and be blind to everything else. Instead, let's understand this is all connected. And if that's the case, well, who's leading the way? This is an interesting debate in science. Is it the heart that leads the way? Is it the brain that leads the way? Is it the soul? And my answer is that it is the soul, because I think it's both the easy answer because it's hard to define, but also the very difficult answer because that's the complicated introspection of, well, what is my soul? What does that really mean? And my best explanation of what is the soul is just that, the combination of all of the holistic factors, the physical realm, the psychological realm, the environmental realm, and the unexplainable spiritual realm. And is that operated by the brain? Is that operated by the heart? I don't know. I think it goes hand in hand. You don't need to be religious or even spiritual to believe that there is something we don't understand that's leading the way. If that's the case, well, you can take a Freudian or Jungian approach and look at the subconscious or the unconscious mind and think that maybe the soul lives there. There are many people who say that the heart has its own nervous system framework that's so connected to the brain that we haven't really talked about in modern science, that the gut has its own receptor network and microbial network that's so connected to the brain that we are talking about a little bit more in science. The spirit, the soul, that's, I think, what's in the driver's seat, and that's what we're treating. How do you treat that? That's where we get into all of these factors individually, but recognizing the overlap. And this goes all the way down to, I had a patient just yesterday who said when he was 4 years old, he remembers a trauma that really hadn't really come to him throughout his life until he did some recent work on it. And then it brought him back to what his parents would tell him about when he was in utero and how his mom was very stressed out. And he started to think about, well, is that why I am the way I am? These are all the factors that we can't minimize, all the way down to generational factors that are in our genetics and are passed down to what some people think is past life regression. And do we have some kind of energy composition of a previous life? Like, that's where it gets very metaphysical for me. And I might just draw the line there in my clinical work. But as a student, I want to learn more and more.
Yeah, it's always those factors of the unknown, the pieces that we don't know yet or don't know about, that I think play roles in the puzzle pieces that we haven't yet discovered, but we are realizing they're missing in the care somehow, although sometimes they're harder to define or really say what they are. If we're focusing, you also touched on more of the things that are going right in people's lives or the things that are making them well. Is it really helpful then to, I guess, ruminate on why things are the way they are? So, for example, let's say I'm depressed, and is it even helpful to wonder why I am depressed? Or is it, in your opinion, then more helpful to look at the things that I can do that will help, or the things that I can do that will up my mental wellness, for example? Because if we're not having a diagnosis, we're not really labeling anything in that sense, should we even expend all this energy on figuring out why or which trauma exactly caused this or why we are this way? Or is it more helpful to then look to what could be helpful in this situation?
Yeah, beautiful question. I think the short answer is we look at ourselves as energetic beings and we're in a state of energy that isn't in line with how we want to feel. First, do we really know what we want? Sometimes what we might label as depression or anxiety is a necessary sign from our body telling us something that we need to hear. This has become more of in the pain model of medicine. We're all after eliminating pain. None of us are after learning from pain. And I think that's a big part of it. So could we then just take this energetic state and say, however I'm feeling, let's learn from it and then change the energetic model, right? Let's change it to from a molecular level, and through somatic work, through cognitive reframe, through motion and all of the things of community and communion, through altruism, changing the energetic state. Doesn't matter why we are the way we are if we can just alchemize that in a different direction. However, there's one thing I would say to that is the unconscious and subconscious mind still controls us. While we might be able to tap in and change our energetic state, the patterns will continue if left unattended. That's why I think it's important to know why we are the way we are. Maybe not to make it the primary focus, because if the primary focus is just focusing on the present, the energetic state, changing that, then we'll probably more often than not be feeling the way we want to feel. But it's then, why do I keep running into the same patterns? And then the work becomes like heavy lifting rather than our innate being. I think that's the big part of, okay, this is my pattern and this is why it's developed. And if I remove shame, blame, and judgment, then I can learn more about this pattern, guide it, help it evolve, help it continue when it serves me, dial it down when it doesn't serve me. Self-awareness really is key, I think, in addition to then the ability to alchemize our state of being. That's the magic of our work that really excites me. Is it's a multifaceted, never-ending process.
Yeah, that sounds fascinating. I am wondering a little bit about how you work with patients or clients, let's say, very attached to what is happening in the sense that it gives them an identity. Very often, I can blame a lot of things on the fact that I'm depressed or I'm anxious or I have this or that because that runs in my family. It gives me a little bit of break, should I say, in taking responsibility for things because I have some kind of label that makes this happen. How do you work with your patients or clients where this might be their identity? You know, this mental health challenge might be who they are, and this is how they view themselves. And yet, it is also the reason why they are stuck, as you said, in these patterns. How do you help your patients and clients move through that or forward from that kind of situation?
Yeah, love the question. I believe first we have to meet them where they are. And to challenge somebody, to question them, to tell them that their beliefs are wrong, that's not our perspective. That's not our line of work. I don't think there's right or wrong in this conversation. I think there's evolution. I think there's just what's working for you and what do we want to focus on changing. The identity conversation is such an important one because generally, if we talk about the scales of identity, it starts at a fundamental level of the identity that was imposed upon me by others. I grew up in a family where academics are so important, and all of my siblings are physicians. And the identity that my parents instilled in me is that academics have to be important, and it's just who you are. You have to be a doctor one day. I fought it in most of my youth, and yet here I am. That identity was imposed upon me. In fact, I don't even consider myself a doctor. When I wake up in the morning, I'm like, oh, I'm a doctor. It's just, I like helping people. And that was something that was always part of me, even before I had any degrees. That was my self-imposed identity. I'm someone who's loving and caring, and I want to be there for others. Is that right or wrong? That's not part of the conversation to judge. I think it's an evolution, though, from what society feels I should be to what I feel I should be. And there's an evolution beyond that. What does the universe need of me? What has it shown me? What are the unique gifts that the universe has given me? The universe deserves for me to give that back. I'm at a point in my career where I'm very fortunate to say I could probably stop working. I've got a big company. I could just focus on business administration 100% of my time if I wanted to. But I still see patients about 20 hours a week because I feel I have an obligation to the universe. The identity that I am, that was embedded in me through time and experience and love and trauma and everything that I've gone through, has made me able to be there for others in a way. That's my universal identity. It's my calling. And then there's another one beyond that. And this is something I'm now working towards understanding more and more for many years, is the identity of the collective, is that we don't have a unique individual, the identity without the I in it. Let's call it identity, or just denti. So that is, then I am not me. I am my human experience is that I am a person and I'm living a human life from my perspective. But the collective consciousness says we're all connected. We're all part of a greater experiment here. We're all part of a greater being. And if we can connect to the greater connection that science doesn't really explain, well, then all of a sudden the word I doesn't even fit. And there was a whole trend about what are your pronouns. I don't know if that's extended where you are, or if that's still in vogue, and not to disrespect that at all. But my pronouns are we and us, because I really do believe that if I look at myself as not an individual, but as connected to the whole, it serves me and it serves the world even further. That was a very psychoanalytical response to the question of how do we approach someone who's connected to their identity of depression or anxiety. I think first, is that your identity, or is that society's identity imposed upon you? If it was truly your identity, let's recraft it in a way that serves you. Let's realize that it's not really only up to you. It's the world had a lot of intentional crafting into the beauty of which is you. And when you realize that the world not only did that for you, but did it for everybody, and you start to focus on yourself more, and your identity doesn't even matter. You start to focus on yourself less, rather, and the collective more, and your identity doesn't matter.
I like the tangent you went on. This was actually very enlightening, I think, and really helpful, I hope, for listeners also who might find themselves in these different spaces of, I am my fibromyalgia, or I am my chronic pain, or I am my this, that, or the other thing, is maybe to skip back in this podcast and re-listen to what you just said, to get a sense of how can we work with that, and how can we heal through some of these challenges that we're encountering. I like that perspective that you offer. I think this is really, really helpful. You touched in the beginning also on psychedelic therapy. And before we wrap up, I just want to touch a little bit on that, because some people obviously are very much for it. Some people are very much against it. I feel like that's a very split kind of topic when we talk about that. How does psychedelic therapy fit into mental health care? And how does it fit, for example, into holistic healthcare? And what are some of your experiences in where that piece kind of plugs in your work?
Yeah. There's a famous quote that psychedelics are to psychiatry what the microscope was to biology. I think if we think about psychedelics and the definition, the etymology is mind expansion. Really what we're looking at is not only a molecular drug like an ayahuasca or a psilocybin that would be illicit. In my practice, we can't use those. We use ketamine, which is prescribable. But even an experience can be psychedelic without a substance. Many people achieve psychedelic states through holotropic breath work, through transcendental meditation. I think first we need to destigmatize that the psychedelic therapy work doesn't always mean we have to take a drug. Now, for the majority of us, we do, because we're not third generation Buddhist monks who can meditate our way into this. For that reason, a low dose ketamine for my work, I see it as a medication enhanced meditation. It opens the mind. It turns us from a passive passenger in life with all of this clutter in our default mode network, that subconscious background that's constantly ruminating, even when we're not paying attention to it. It takes us away from that and makes us an observer of our own life. And when we get to observe our own life from a emotionally disconnected place, we don't have the same charge, we don't have the same amped up patterns that have been ringing in our head for years and decades. And all of a sudden we get to see ourselves with more love, with more empathy, with more grace. And insights just become downloaded to self. Often psychedelic therapy doesn't even require to sit with someone else and do the psychoanalytic work because the insights are downloaded internally. We all have the ability to be our own healer. I think that's what psychedelic therapy is really introducing to a community that has long been reliant on the physician, on the expert. I think we are the expert. Internally, we know the answers. We just have to get out of our own way. And that's broadly what psychedelic therapy is doing for the community. Those who find it controversial, I understand, because there's a lot of miseducation about out there. And there's also a lot of risk. And we have to be very careful about that as well. Within the boundaries of what's safe and ethical and helpful, that still serves the Hippocratic Oath, do no harm. Then all of a sudden we see there's still so much value in learning more about ourselves and connecting with the parts of our life that maybe weren't getting attention. Now all of a sudden the brain is communicating together in a better way. The neural connections, what we know about psychedelic therapy. The last thought I want to share with those who this may be a new topic. One term I want everybody to learn, and that's neuroplasticity. I'm sure you're familiar with it. I'm sure most of your listeners are. But for those who maybe this is the first time they heard that term, neuroplasticity alludes to the fact that the brain keeps evolving. New neurons keep being formed and new neural connections keep being established. So whatever pattern we've been running into, the old adage, you can't teach an old dog new tricks, I believe that's not true. I think that it's harder to teach an old dog new tricks. What psychedelic medicine has taught us is that sometimes maybe medicine, a drug, helps the brain become more malleable so that we can learn the new tricks and unlearn some of the ones that haven't been serving us. All of that done from a frame of my entire journey is beautiful. And if I can keep evolving today, why not? It doesn't mean I'm deleting the past. It means I'm evolving it. I'm learning more about myself. And I'm making it easier to do the therapeutic work that we all know we need to do.
Amazing. Thank you for sharing that. And again, I find this a fascinating perspective. And for our listeners out there who are curious about this and who might be very curious now after having listened to our conversation here, how can our listeners get in touch? What kind of programs or services do you offer? You said that you were in over 30 states, so North America only, or can people contact you also internationally? What do you have available for our listeners?
Yeah, thank you for the plug. So in the US, if any of your listeners want professional health care in the states that we are in, it's virtual, it's online. You can go to anywhereclinic.com. If you're not in the US or in those states, you can learn more about what we're offering and bring it to your local physician. Portal.anywhereclinic.com is our free member portal. Anybody who wants to sign on can learn more about ketamine therapy. You can learn more about holistic strategies and really our curriculum that we have that's based in self-healing, self-growth, self-love, and self-transcendence. So all of that is out there for free. You can follow me on my socials. I'm sure the links will be provided at Dr. Sam Zand on all major social media outlets. And really just the education, I think there are many experts out there in today's modern medicine, also in the shamanistic world. But what we all should be rooted in and understand is that this work has been around for thousands of years. And the medical model of the last 100 years is a profit-based model. And while psychedelics were not part of that model until maybe the last 5 years, it was part of the model for thousands of years. So for anybody who wants to learn more, let's look into the ancient cultures and the way that we use peyote and ayahuasca and psilocybin, all of that just out there, far more expert than me in my modern medicine practice.
Thank you for sharing that. And we will be linking to resources and your socials in the show notes as well, as you mentioned. And make sure that our listeners can find the resources that you provided and find your clinics if they're living in the US and they're inspired and maybe they want to take a different path with their mental health. They might want to have different options, or maybe they're at a point where they're ready to kind of open the door a little bit and look at what else is out there to help their mental well-being. We will be linking to all of that in the show notes for them. Now, Dr. Sam, thank you so much for joining me today. I find this has been a very enlightening conversation, and I learned so much in this past half hour that we've spent together. And I hope our listeners feel the same and took away some of those gold nuggets that you shared all throughout the episode. So thank you so much for your time today, and thanks for joining me today.
Thank you so much. It's been a pleasure. And I hope that all of the listeners remember we're all uniquely beautiful. There's nothing wrong with us. There's always room for growth. There's always room for healing. Let's also make room for love and transcendence beyond just focusing on ourselves, focusing on the greater causes in life as well.
Beautifully said. And we'll leave our listeners with that. And thanks so much, Dr. Simon. Take care. Thank you so much for taking time out of your day to listen in. If you enjoy the Jōrni Podcast, please support us by subscribing, sharing on social media, and leaving us a review. We appreciate you. And you can find more of The Jōrni on Facebook, Instagram, TikTok, and our website, thejorni.com. Sending you love and courage, and see you next time.